Hi, we have Shireen today to speak on Health Stories Speak. She's a young lady, and I'm really grateful to her for speaking to us today. It's a gyno health issue, and I think it's really brave of her to speak on this health issue. I think it's a rare condition, but I understand that it is quite common. So it's really nice to hear Shireen talk about it. Shireen, it's over to you.
Thank you so much, Manju Auntie, and thanks for having me here. It's something that I feel very passionately about is raising awareness and making sure that people understand that women's health is just so important. It's often overlooked in terms of medical training, and there's just so much inherent bias in our system. I am 36. I live in Berlin, Germany, but I'm very often between Berlin and New York and escaping the winters in Delhi. So I've been sort of navigating all three health systems as well as the Italian health system, which is where I grew up. And I can say that the challenges are similar across the board. So last year I was officially diagnosed with endometriosis as well as adenomyosis. This year also found ovarian cysts. And I'm happy to tell you a little bit more about sort of the path to diagnosis and treatment there. But did specifically want to comment on what you had said around it being sort of a rare disease versus more common. Um, I think this is one of the biggest learnings that I've had is, I've experienced symptoms for 15 to 20 years, never realized how interconnected they were. And endometriosis is actually a very common condition. It is in 1 in 10 women, and it takes an average of 8 to 11 years to be diagnosed. And I think that's absolutely unacceptable. And the only way we can change that is by raising awareness and by talking to each other. That's how I was able to connect all the pieces, is because I spoke to a friend of a friend who also has endometriosis. And so I'm so glad that you are putting stories together like this for people to hear.
Yeah, thank you. Thank you, Shireen. I think it'll be, you mentioned that it takes about 10 years to diagnose. Those are very important, whichever age group you're in, that's a lot of time to diagnose it. So it makes your story even more important, I think, for the girls and for ladies to know about it. So, what will be useful is, Shireen, if you can mention the symptoms clearly, because I think it's from the symptoms that people can think about raising these questions with the doctor, with the gynecologist, as to checking those boxes as to whether it is this problem or some other health issue. So maybe you can speak about the symptoms a little, and how finally how did the diagnosis arrive.
Yeah, absolutely. So I think one of the biggest learnings I've had in this process, and I'm sure this has come up in some of the other stories with people you've been talking to, is just how important it is to be your own health advocate. As I mentioned, over 15 to 20 years, I experienced many different symptoms, never realized they were so interconnected. I've always had terrible digestive issues, very sensitive to anything I ate, would get stomach aches even when I had only water. Sometimes the pain would be so bad, shooting into my spine, that I wouldn't even be able to get off the couch. Shooting pain down my legs. Since the age of 12, 13, when I first got my period, always had very heavy periods and very long periods, about 14 days. Terrible headaches. And sort of in the last couple of years also developed a vertigo condition, which means the room would just completely start spinning and I wouldn't even be able to get up. This is not something that's always connected to endometriosis or adenomyosis, but I've since learned that it is connected to hormones, so it must all be interconnected. My lab reports also specifically showed high levels of inflammation as well. So um, really, I spent 15 to 20 years shuttling between different doctors. I had heard a whole combination of different things, from your body's just used to being in pain, you should just take painkillers, to you need to change your diet. Why don't you try eating only burnt toast and black coffee, which I find absolutely absurd. Um, But then also I had gone to numerous different gynecologists and they all disappointed as well. So I think one specific learning for endometriosis and adenomyosis is this is not something you can see on an ultrasound. You don't see endometrial tissue growing on an ultrasound. This is something that can only be diagnosed through a laparoscopy. Unfortunately, a laparoscopy is invasive. It's a keyhole technique, what they call, which is little incisions on either side of your belly, and they just kind of go in with a camera. If they find endometrial tissue, which is essentially extra tissue growing outside of where it's supposed to be, they will then, and there during the laparoscopy, conduct a surgery and either cut it off or burn off the tissue. Endometrial tissue can grow in different places. It can stay in the general area of, let's say, intestines and fallopian tubes and ovaries. And that's what I had. So everything was very stuck together, which is why when I also used the bathroom, I was in pain, regardless of whether what I was doing, I was in pain. And that's because the tissue had stuck together also in my intestines. Um, so I think biggest, most important learning is to tie those symptoms together in speaking with a doctor, to not look away at high levels of inflammation, and to not let someone tell you that just because you don't see something in an ultrasound means it cannot be endometriosis.
So all the symptoms that you say, in terms of the pain almost everywhere, and also the long periods, I think girls should be conscious that if these symptoms are appearing, then you need to go for laparoscopy, did you say? Or how it doesn't.
Yeah, I mean, I think it's really listening to your body, right? I think women's pain is very often discounted and disregarded, and we are told that being in pain is normal. And of course, menstrual cramps are not comfortable for anyone, but I think we all know our bodies well enough when there's a level of pain that is just not normal. And we should listen to ourselves and not let the system sort of gaslight us into thinking that that pain isn't real. Um, but I think tangibly, my advice would be to package up those symptoms together for your doctor, because what I was doing was going to a gastroenterologist to talk about my digestive issues and stomach problems, going to an ENT to talk about my vertigo, and going to the gynecologist to talk about my heavy menstrual bleeding. But actually, if you can combine that all together, and then also raise the question about whether laparoscopy is the right thing to do, I think that would be ideal.
Right.
I didn't know what a laparoscopy was until just a few weeks before I got it. And that's because I work at a AI-based health tech company that specifically has an app for symptom assessments. And based on the symptoms, it suggests the condition that you might have. I work in the commercial side, I work with clients. And so when I first started working at this company, I played around with our app. So it's called Ada, just to demonstrate to my client in the next meeting I was going to have.
Right.
And the first condition that popped up was endometriosis. It took me 3 minutes to complete this assessment, something that took me 15 to 20 years to convince any doctor about. And when I saw that in the report, I just started crying. It was very emotional for me. And the report told me that the only way you can have this diagnosed is a laparoscopy. And so that's the information that I then took to speak with my primary care doctor, who then referred me for the laparoscopy and the surgery.
So the specialist to go to in this case for the surgery would be who? What specialists are we looking for?
Yeah, that's a good question. So I think this depends a little bit on the country that you're in. There are definitely clinics that specialize in endometriosis. So that's something that I would do. I would probably talk to either the primary care doctor or the gynecologist to get that referral out, and then ask specifically for a referral for a laparoscopy at a clinic that specializes in endometriosis. I would also, try to do your own research around like what clinics are good, which doctors are good, and not just take any recommendation at face value. Um, I specifically went to a clinic that specializes in minimally invasive surgery for endometriosis and what are like difficult gynecological situations. I would say my experience in the hospital, it required me to be inpatient for 2 days, which is not the case all over the world. Some places are 1 day, some places I think are no days inpatient. Um, and I had a very good experience when I was there, but I did not have a good post-op experience. Nobody followed me post-surgery. Nobody really clarified the changes that I should make. And nobody really checked in on what the surgery had done for me after it was done. So when you have endometriosis or adenomyosis, which is the same thing, but the tissue is growing inside the uterus, you shouldn't be on a birth control that includes estrogen, because estrogen is part of what causes that growth of the extra tissue. I assume this was explained to me post-surgery, but I was in such a daze and also very emotional. So I don't think I quite processed that information. So I didn't end up changing my birth control from the estrogen birth control to the progesterone birth control until about 8 months post-surgery.
Right.
Um, I also had a lot of pain in the area for about 9, 10 months, as if the surgery had just been completed only the week prior. So my skin was very sensitive. The entire area felt very bruised, and even wearing leggings or just touching that part of my stomach was so uncomfortable. So I think my recommendation would definitely be to, find a clinic that is recommended. Ideally, someone has also been. Like I said, 1 in 10 women, so surely there must be someone in your network that you know. But also, do your own research and make sure that you've got a good post-op plan that's set up for yourself.
Shireen, I would like to, certainly from this platform, we also
Mhm.
want to inspire confidence. The story should be inspirational. So I know you had a long way before this could be diagnosed, but currently, after the surgery, how do you feel? And how do you think it's been taken care of, or did the doctor say that you have to be careful about certain things? What are the do's and don'ts? Mostly, that's my question.
Mm-hmm. I think the biggest change for me was actually the mental change. It was such a relief to know that I wasn't actually crazy, that my pain was real, that I wasn't making these things up, and that everything really was interconnected. So I'll be honest and say the surgery does work for a lot of people. It doesn't work for everybody. Um, in my case, it didn't really make too much of a difference. Um, and I already know that tissue does grow back. So I just had an MRI for a hip injury a couple weeks ago, and in that MRI for my hip, they found ovarian cysts, which is likely related to the endometrial tissue as well. So I mean, I want to say something inspirational, but I will also say something honest, which is there is no cure for endometriosis right now. It is a chronic pain condition. But what you can do is feel that your pain is real when you get a diagnosis, and you can then manage your pain accordingly, right? I have an amazing plug-in hot blanket. I have a great fuzzy hot water bottle. I have the warm socks to wear when I am not feeling well. I know when to go get a massage. I know when to be more mindful of my body and do yoga instead of going for a run. So I think there's a lot of mental peace
Right.
that came with the surgery that I just did not have before.
No, that's really nice. I know I feel, I mean, I'm sorry that you have to go through this and you went through so much, but it's also very positive to hear that you've learned to manage this pain. And by doing different things, the life can go on. Would you, would you,
Absolutely.
would you like to add
Absolutely.
any other uh, points at the end in terms of, if somebody is suffering from this? I think one takeaway from what your talk was, talk to the others. I think it's very, very important to find some others who may have gone through this, And
Yeah.
also in the beginning, what you said about the symptoms, trying to bring together different systems rather than running to different specialists
Yeah.
could be a
Yeah.
step in the right direction.
Definitely. I mean, I think the community is most important, right? I mean, talking to each other, but also, I think it's 2023, but the reality is a lot of society is still very uncomfortable talking about women's healthcare issues, particularly as it relates um, to menstruation, to fertility, to heavy bleeding, and if we can just break down some of that stigma, have those conversations more openly. Your story could, help someone else shorten that time to diagnosis from 8 to 11 years, maybe to 5 to 3 to 2. And, if there are tools out there, like this symptom assessment tool that I had shared,
Could you mention the
or
name of the app once again? You mentioned the app that
or it's ADA, ADA, and it's
you
available all around the world.
okay.
If there are tools that have worked well for people to share that. I know there are online patient communities as well, such as yours and patients like me. I think we need to talk about this more openly and not feel like we need to suffer alone. So thank you so much for giving me the opportunity to also share my story.
Thank you. Thank you so much, Shireen. I really appreciate this.
Take care.